All right, my name is Bryn, and we did digital imaging. When images are taken, radiologists are able to use a certain software program to upload these images to a computer. There, they are able to make reports, sign off on images, and send them directly to a healthcare provider that ordered it. This allows for faster diagnosing and a better prognosis for patients because the healthcare provider is able to view and make reports before the patient comes in. This decreases the time at the office and can provide a better quality of care to the patients. So some history. On November 8th, 1895, William Conrad Röntgen accidentally discovered an image cast from his cathode ray generator, which is known as electron beam. William Coolidge invented the X-ray tube, popularly called the Coolidge tube. In 1896, one of the first radiography departments was set up in Glasgow Royal Infirmary. This was also the year the first diagnosis was made. Saw a penny in a child's throat, the legs of a frog moving, and a kidney stone. In 1947, the ultrasound was developed. In 1974, the MRI machine was developed. In 1997, the digital X-ray was developed. It was introduced. So some digital imaging companies: GE Healthcare, Eastman Kodak Company, RTI Electronics Incorporated, All Imaging Systems Inc., Fuji Photo Films USA Inc., AFP Imaging Corporation, Sirona Dental Systems Inc., Radius Health, DIS Digital Imaging Systems.
So X-ray is our first topic. I'm Kate, by the way. X-rays are a type of electromagnetic radiation. An X-ray machine sends individual X-ray particles through the body and produces an image that is recorded on a computer or film. Positioning is important when needing to look at a specific part of the body, and the person must stay very still during an X-ray to prevent the image from becoming blurry, but the whole process of getting an X-ray is painless. Structures that are dense, such as bone, will block most of the X-ray particles and appear white. Metal and contrast materials, such as different types of dyes, or if they're wearing jewelry, will also appear white. Structures that contain air, much like the lungs, will appear black. Muscles, fats, and other fluids will appear on the image as different shades of gray, and all of this compiles and makes an X-ray image. And a few examples of images of X-rays. We have a chest X-ray in the upper left-hand corner. You can see the ribs, the lungs, and part of the humerus and clavicles. Below that, we have an image of the skull, the cranium. You can't see the brain, only the skull part, only the bone part of the skull. And right-hand side, we have the hand. You can see all the metatarsals, the tarsals, phalanges, part of the radius, and ulna.
Okay, my name's Carrie, and I'm going to talk about ultrasounds. So an ultrasound is a medical test that uses high-frequency sound waves to get a live image from inside the body. Ultrasounds allow healthcare providers to view internal body organs without surgery. There is no radiation involved, so it's safe to use for pregnancy. An ultrasound technician, also known as a sonographer, applies a lubricating jelly to the skin that reduces friction that may be caused from rubbing the transducer on the skin. The jelly also helps transmitting sound waves. The transducer sends high-frequency sound waves through the body, which then bounces off dense objects, such as organs, then transmits a picture to the screen. So these are some pictures of ultrasounds. In the top left, that is an ultrasound of the heart, and it shows you the valves. Beneath that is just the process of getting an ultrasound. To the right of that is just showing that the sound waves aren't harmful to a fetus, so therefore it's safe during pregnancy, and above that is just an ultrasound of a baby in the womb.
So MRI is magnetic resonance imaging. This type of imaging uses a strong magnetic field and radio waves to create a detailed image of the organs and tissues within the body. The images taken transmit to a computer where they can be easily viewed. Sometimes a contrast dye is injected into a patient to improve the appearance of the tissues and organs. It's important to not wear jewelry or anything that could be magnetic when going into the scanner. Because of the fact that the scanner is small, it is recommended that claustrophobic patients do an open MRI. It is also important to stay still when getting an MRI. The imaging can be very loud, so most facilities allow patients to use headphones and listen to music while getting an MRI. Here are some pictures. In the top left corner is an image of the brain, and next to that is a knee, and below that is what the MRI machine looks like. And my name's Rachel.
Okay, so we're going to talk about CT scans, which stands for computed tomography. This is also called a CAT scan, which means computerized axial tomography. This specializes in cross-sectional images. X-rays then beam a specific area of the body and many different snapshots are taken. The snapshots can be examined to identify abnormalities such as tumors, blood vessels, broken bones, and more. And here are some pictures of a CT scan. The top left is just what the machine looks like, and then at the bottom right is a CT scan of the brain.
And here are our references.
Thank you so much for listening to our presentation.